You're still live with us on News Central now. The news continues with the migration of doctors and other health workers in Nigeria to other countries, which is taking a toll on hospitals across the country as the institutions have reduced the number of their outpatients and surgeries due to a shortage of manpower. Now, investigations show that almost all the health institutions were battling with the shortage as they could not cope with the high number of patients who thronged the government hospitals, which were affordable compared with the private ones. The chairman of the House of Representatives Committee on Health had on Wednesday raised the alarm that not less than 5 wards with about 150 beds have been closed down at the Lagos University Teaching Hospital, Idiaraba, due to a shortage of health workers. Now, the chairman of the committee, Dr. Amos Mogaji, also said the 5 wards had to be shut because there were no workers to operate them, despite the large number of patients received at the institutions daily. Now, to help us make sense of this development, I'm being joined by Dr. Ayomide Owoyemi, Health Informatics Researcher, University of Illinois, Chicago. Thank you so much, Dr. Ayomide, for joining us.
Thank you very much. It's nice to be here.
It is nice to have you indeed. Dr. Ayomide, it is a pandemic that we're experiencing a shortage of health workers in Nigeria. How has this shortage impacted the quality of the healthcare services that is being provided in the country?
Yeah, I think one of the most important ways to put this into context is to, first of all, look at what used to happen. So prior to this time, we didn't even have enough. Now, the little we have is being lost to what I would say places where they see that they can have better opportunities. Now, the challenge with that is, one, a lot of people cannot get the care they need when they need it and as at when due. The second challenge is the fact that people need to access some form of other higher levels of care, which I would say secondary level or tertiary level of care can do that. So the challenge that brings is, one, that there will be increasing in people having some sort of illnesses that could be tackled at an early stage, but would now progress to a more chronic level. And then the other challenge there is that I'm not sure we've started looking at this thing, but I'm sure if we start to conduct a study, we'd realize that our entry indices will start, going much worse. We'd have more child mortalities, more maternal mortalities. For example, a lot of women need surgeries to complete their delivery, or they need to get their delivery done. A lot of those people that would do those surgeries or that are supposed to monitor those women are not available. So we've not really been able to grasp how bad these things are. We're just sort of, looking at the surface. But I'm sure if we conduct a study to dive deep into what the effect of this has been, the picture will be very, very bad.
Dr. Ayomide, you did mention that some of these people travel out to get better opportunities. So can we say that that is the main reason behind the mass migration of doctors and health workers to other countries, or are there other reasons?
So interestingly, there was a poll that was conducted, I think in 2016, NOI poll, and one of the things they did was that they sort of interviewed a lot of doctors to understand why doctors were leaving or why they wanted to leave. Interesting thing at that time was that I think about 60 to 70% of doctors would take the chance to leave the country. Now, it wasn't this bad then, now it's much worse. But one of the ways to look at this problem is to look at push and pull factors. So pull factor is the fact that the pay is better elsewhere, the life is better elsewhere, standard of living is better elsewhere. But we also need to consider the push factors. And some of the push factors are, one, doctors are not paid on time, or the pay is not good enough. So a very good example is OUTHC that was just in the news about the fact that they'd lost a lot of doctors. There are doctors in that hospital that have been owed salaries for up to 6 months. Imagine that kind of person in that situation. Even if he didn't want to leave before, that kind of situation would accelerate his desire to leave the country. Other push factors I would see are, the general insecurity in the country, the level of, the state of the economy, and then at times the working conditions that these people have to sort of deal with are some of those push factors. So it's a mix of factors. There are pull factors, there are push factors. The looking for better life elsewhere is a mix of pull and push, but everybody, when they have a chance to get a better life elsewhere, would be incentivized to move. And that is why solving the problem goes across looking at those factors, the pull and the push. Unfortunately, it does seem that right now, it is not a battle that we can win, because the pull factors are far more stronger, and then the push factors are getting much worse.
Well, I would say now that the damage has been done, all things being considered, the push and the pull factor. So in your opinion, what measures do you think can be taken to address the shortage of health workers in Nigeria? Because if we continue like this down this path, we'll end up not having, already we are short staffed. So if we continue like this, we'll end up not having any health worker at all in the country. What is the solution?
So I think a couple of solutions were actually pushed in that NOI poll, and this sort of revolved around improving pay. But the challenge is we can't compete. We can't compete. A doctor goes to the UK and earns the amount he earns in a month. I mean, he earns in a year, earns it in a month in the UK, and then his life changes, transforms remarkably. So we really can't compete on pay. But what we can compete on are a few things about making the people who want to stay. So the interesting is a lot of people do want to stay. They don't want to go elsewhere. But making it more attractive for them to stay. So by improving their pay, at least to a livable level. The other thing is by improving the states in which they work. Equipping the hospitals, providing all the necessary tools they need. Now, the other part that comes into play, which is more practical to me in the sense, because like we are saying, this is the battle we can't win. It's about how to mitigate the losses. So how do we mitigate the losses? One is to increase the facilities that are training and churning out healthcare workers. It puts more funds into that. Now, the challenge is, you would say, is that after a few years, those people would also leave. Yes, but the thing is, if we keep producing at a very reasonable rate, we can still, to a large extent, mitigate the period between when they are done and when they leave. Most people do not leave immediately they finish. Most people leave after a while because it's actually expensive to move elsewhere. Now, the other thing we also need to do is the fact that we need to start considering how to upskill low-skilled healthcare workers, because interestingly, those are the large number of people that actually serve most Nigerians. Most Nigerians go to primary healthcare centers. They go to basic healthcare facilities. And the people in those healthcare centers are community extension workers, they are nurses, they are village extension workers. Those people have been offering care for a long time in the country. Like if you go to places outside the urban center, so that's people that are delivering care. So what we can do is to equip and upskill those people to offer more quality care. And that to me seems like a much more practical step long term to plug those gaps. Now, the other thing that comes into play are improving the economy. One of the things I always tell people is that healthcare is not suffering alone. Healthcare is suffering because the whole country is suffering. It's more or less like a systemic disease. If I have a systemic disease, then parts of my organs will be affected. If you treat that organ and you don't treat the system, then that organ would get damaged once again or all over. So solving the state of the country is actually very significant in stemming that trend. So like I've highlighted, one is improving the standard of living, improving pay, upskilling low-skilled healthcare workers, improving the state of healthcare delivery, and largely improving the country as a whole. Those are like the practical ways I think we can go about solving this.
All right, Dr. Ayomide Owoyemi, Health Informatics Researcher, University of Illinois, Chicago. Thank you so much for joining us to give a better perspective of this development.
It's a pleasure. Thank you very much for having me.
Pleasure as well.